Cheyanne Daniels, race and politics reporter at The Hill, is here for our next panel exploring rural inequities and equity impact on communities of color. Thanks for being here, Cheyanne.
Thanks so much, Bob. Betsy Huber is the president of the National Grange, a grassroots membership organization serving rural and small-town residents with community service and issue advocacy. Pamela Price serves as the deputy director for the Balm in Gilead, managing the various health initiatives of the organization. She's also the director of the National Brain Health Center for African Americans. And Dr. Gladys Maestre is the director of the Rio Grande Valley Alzheimer's Disease Resource Center for Minority Aging Research, as well as a professor of neuroscience and human genetics at the University of Texas Rio Grande Valley School of Medicine. Welcome to all three of you.
Thank you. Thank you.
Yeah, so Pamela, I want to start with you. Doing some research, what we were able to find was that Black Americans are 2 times more likely to develop Alzheimer's than white Americans. Do we know why? What's causing these discrepancies? But then on top of that, how are you working to help educate Black Americans about these discrepancies?
Thank you again so much, and a great question. And the really reality is that there are multiple reasons why we see African Americans and other minorities being disproportionately impacted by Alzheimer's disease. One of the largest reasons is the fact of the comorbid condition. So we know through research that individuals who have diabetes or high blood pressure or high cholesterol, that's going to significantly increase your chances of developing Alzheimer's or dementia. And if we just look at what those rates look like for those chronic diseases, African Americans bear, again, disproportionately high burdens of those diseases. Another thing that we have to consider when we look across the racial and ethnic lines is the access to preventive health care, which is lacking in minority communities and also as well as in our rural communities as well. And there's also just a need of awareness about what this disease is. And then realizing how do we take the science that we have, such in some of the genetic testing that we now have access to, but these communities can't even get access to that, to say that if I have a family risk of Alzheimer's and dementia, and I'd like to know so that I can, again, begin to either look at lifestyle changes that I can make and adapt now. And so, it's a multi-pronged approach that I think is going to be necessary to change it. Our work with the Brain Health Center hinges upon that. So it's about raising awareness in these communities, and then it's about being that bridge to academia, to research, to healthcare, to be able to close some of those gaps and doing it in a culturally appropriate way.
Yeah, and just talk a little bit, if you can, about what that culturally appropriate way means.
Yeah, so I think first it's understanding that when we say Alzheimer's or when we say even dementia or just brain health in general, we have to really explain to these communities, well, what does that mean, right? Being senile is something still in the African American community that's seen as a normal part of aging, and it is not. So it's coming in and dispelling, what this disease is, what does normal aging look like, and what it doesn't look like. And then also being able to understand where these community are, and not just in a geographical way when we say let's meet people where they are, but really thinking about mindset, thinking about some of the economical challenges that these communities are already facing, as opposed to just coming in and saying, well, you need to do this, you need to do that, go get your doctor, go have your cognitive assessments done. So when we say cultural, we're trying to also be mindful of how these communities view health, how these communities view our healthcare system, how they've had perhaps maybe negative experiences, and then being able to connect them to trusted resources. Our vehicle that we use predominantly is our faith-based institutions, housing more services and information in our actual congregations and mosques, and these kind of more community trusted partners is a really great way to cut through some of that noise, and also making sure that individuals feel like I am being seen when you are providing that information. And even as the video from Lily, that we're not just here as a one-off, but we're really saying we're trying to build within your community so that we can address, all of these complex issues when we're talking about Alzheimer's.
Absolutely. And Gladys, I want to come to you quickly as well, because one thing that Pamela mentioned is about minority communities as a whole being impacted by this. And the Rio Grande Valley is at the epicenter of the Alzheimer's spike among Latinos, and is now becoming a focus of new research efforts. So I want to touch just very quickly on what can you tell us about what's causing this spike?
Thank you, Cheyanne. Thank you. Gracias for this opportunity. So there are many things that we think are happening, and many of them have to do with the social determinants of health. This is one of the poorest areas in the country, and access to any type of healthcare is difficult, particularly for older adults. Public transportation is very hard, and the rates of comorbidities such as diabetes and uncontrolled hypertension are very high. So we believe that all these things are coming together to put Hispanics, in which represent about 95% of the population here, to a high risk of Alzheimer's and related dementias. And the other thing that we think it might be playing a very important role has to do trauma. This is an area of high migration in terms of entrance to the country, and sometimes not in the best of conditions. So, and the border itself is very fluid. So a lot of our older adults have their family members on the other side of the bridge. So all these limits the availability of the family for care, to provide the right care for the older adult.
Betsy, one thing that we've heard both Pamela and Gladys speak about is lack of access. And that's something that you were recently discussing in a piece that you wrote, where you were saying that Medicare's Alzheimer's policy actually cuts off rural communities. I'm just wondering how that works, and just explain a little bit more about how we're seeing this discriminatory policy.
Sure, thank you very much. Living in a rural area is wonderful, but there's a lot of inequities that rural residents deal with, especially in access to health care. There's fewer doctors and great lack of specialists. Many rural hospitals have closed. 136 closed between 2010 and 2021, and many more are at risk of closing. Access to transportation has already been mentioned, and distance from medical care makes time an issue. If you need to drive for 2 hours or more to an appointment, a simple doctor visit can take most of a day, not to mention the gas prices. So with Alzheimer's disease, the lack of access can mean underdiagnosis and late diagnosis, causing rural areas to see nearly twice the Alzheimer's death rate as urban regions. It's already been mentioned that agricultural workers are almost 50% more likely to develop the disease. Rural residents are older and sicker. The risk factors for Alzheimer's: high blood pressure, obesity, diabetes, depression, alcohol and tobacco use, even age, are all higher in rural America. So the fact that the new drugs are only available at study centers, research centers in major metropolitan areas is really discriminatory. It leaves rural residents out of access to care.
When we look at how to sort of combat some of those discriminatory elements, is it as simple as getting more transportation to these communities? Is it as simple as finding ways to bring the medication closer to the communities? What can be done to help counterbalance some of the issues that we're seeing?
There needs to be a way to attract more medical professionals to rural areas. Loan forgiveness, possibly, just some enticements to have doctors, nurse practitioners, specialists locate in rural areas. That would be a big benefit. And access to transportation is also needed, but if the medical care is closer, then transportation is not so much of an issue.
Pamela, I want to come back to you because you helped to develop a program for nurses to help address knowledge gaps when it comes to Black Americans. Talk a little bit about this program and sort of some of what you've seen come out of it so far.
Yes, and really, so my journey with Alzheimer's, so as a nurse, so as a registered nurse, having gone, through school, and then, as I was working, and my grandfather was diagnosed with Alzheimer's. And it was made immediately clear that the little bit of kind of either, gerontology or even kind of just brain or neuroscience that we get just a little taste of in nursing school was not, it didn't equip me, even as the educated member of our family, to be able to fully understand what we were dealing and grappling with. And so in my work with the Balm and Gilead, when we created our center, we wanted to make sure that we were not only educating the community, but kind of to Betsy's points, we needed to make sure that our nurses, our allied healthcare professionals, and even our providers understood how this disease was presenting itself in these underserved and underrepresented communities. And so we went about creating this 6-module curriculum for nurses, and then we opened it up actually in year 2 to allied healthcare professionals when we saw a need and a request for individuals who were like social workers or maybe working in pharmacies and community centers. And so what we did with it is to, in addition to having more of just the didactic of what is dementia, right? What is Alzheimer's disease? What are these rates? How is it disproportionately affecting these communities? But then also allowing nurses to see the different roles and many hats that we wear and how we can support patients as they come into the clinical setting, because we're that front line. Providers have 15 minutes maybe during a visit, but it's usually the nurse who's answering the phone. It's the nurse who's doing the follow-up. And then even with the allied healthcare professionals, our lab technicians, our social workers in our social services departments, we're thinking and needing to how people touch and interact with our systems. And I think at every one of those touch points, we need to make sure that our patients are getting the information that they need, that they're feeling that they are being respected, that their questions are being answered, and we can kind of shift that power dynamic, I think, that exists between some minority communities and our healthcare system, so that we don't leave a doctor's visit like my grandfather would, and he'd have 20 questions and he just wouldn't ask. He just felt like the doctor told him everything he needed to know. And so that's kind of the cultural element to what we do. And so we want to try and equip nurses to be able to shore up some of those skill sets that we think is missing. And what we found on the kind of post-analysis and our evaluation is that it was very beneficial. Not only did nurses feel like their knowledge had increased about Alzheimer's and dementia and what the disease actually was, but they also felt that the curriculum empowered them to actually, kind of have a more engaged and more informed role in the actual, healthcare of these patients.
That's incredible. And Gladys, you have found a way as well with connecting to pop culture a little bit. Talk a little bit about how you have used the movie Coco in your work.
So we have developed different strategies, some of which stand what Pamela is saying with community health workers. We train about 400 every year, and we have continuous programs for them in South Texas. So we have to provide tools that will facilitate conversations. And one of those tools is it's this movie, Coco, and around, the life of the family and why, what is the role of memory and being happy and fulfilled and love. And we said memories of the heart, recuerdos del corazón, that you might not remember who this person is or the name, but if you love them, they are there with you. So we try to support conversations that are not too scary, but really targeting, life as it is and how it is perceived. And I wanted to add to the cultural aspect. It's not only the fact that they are rural or Hispanic, it's also that we scientists usually talk in certain way, or as medical professionals in certain way that sometimes it's not really natural language. So we try to acknowledge that we need to listen and we need to respond, to be responsive. It's not just talking to the people, and try to see what they are really looking. And so many times it's just a way to contribute for a better future.
Betsy, I want to come back to you because one thing that is consistently standing out when we talk about the lack of access, these disparities, what do you want to see from the federal government to help address some of what we've been talking about today?
Well, just this week, we wrote a letter to the House Ways and Means Committee urging them to put pressure on CMS to approve these drugs without going through the clinical studies and the distance to an urban center to participate in the trials. So we're trying very hard to put pressure on CMS, get our legislators to do the same, and our members. We have 150,000 members across the country that many of them have been touched by Alzheimer's. I myself, my mother, and several aunts suffered from the disease. So we all have that personal experience that can be meaningful when we talk to our legislators and get the message to CMS that we really need these drugs to be available for use, because they're for early stages. They only work in the first stages, and for rural people, that early diagnosis is difficult because of the distance to medical care. Maybe farmers are too busy to take time to go to a medical appointment to get that early diagnosis. So that's really important.
Absolutely. And Pamela, also back to you, what is the biggest challenge facing Black Americans right now when it comes to Alzheimer's? Is it lack of knowledge? Is it, again, like Betsy was saying, area? What do you think is the biggest issue that needs to be addressed?
I think the biggest issue now is reimagining. To Betsy's point, I think we have to reimagine where care needs and should be taking place. Because I think we do sometimes maybe overestimate the knowledge of these communities, and that still needs to happen in terms of raising awareness about what this really is. But to Betsy's point, it's slightly disheartening if we can educate you on what it is, but you can't get to a doctor to get screened, or you can get to a doctor, get screened, and you get your diagnosis, and now due to our coverage decisions, you can't get access to the medications that you need. So for us, our biggest hurdle right now is that we've got to figure out how to close the loop, right? We have to think about what our communities are need in a very circular fashion, and we need to start to build with them in mind, and reimagining. The healthcare doesn't have to happen in urban areas and urban centers, that it can happen. We can set up clinics in tents. I served in the military. We can put a full-fledged, full functioning hospital in the middle of Iraq. We can put them in the middle. We can definitely close this gap in terms of our role. And then in terms of where our minority communities live, being able to connect them in ways and in places and spaces that they feel safe to actually navigate our system are the biggest challenges that we have, that I feel like you do more to address those.
Yes. And Gladys, I just want to close with you very quickly. When you're looking at what the statistics from the Rio Grande Valley are showing, but also the research efforts that are being done there, how do you see this being able to extrapolate perhaps nationwide so that some of these gaps across our minority communities could close?
I think that one very important aspect really has to do with getting close to the families, because even though we have a lot of individuals that actually do not have families, that's also a reality. But I think the families provide a good linkage, because then in the case of Hispanics, family values are very strong. And once you have that buy-in by the family, then this will bring older adults to the clinic for anything, and then for with any motivation, but then the mental health and the cognitive assessment can be done much quicker. And I think that this also the family values of the of different ethnic groups could be used, could be leveraged to help to close this gap in the access to care. And if there is somebody in the family that uses a phone, cell phone, or internet, then that's another opportunity, not only for being in touch, for being educated, but also to establish the social connections that the patients and the caregivers need.
Yes, thank you, Betsy Huber, Pamela Price, and Dr. Gladys Maestre for joining us on this incredibly important topic.
Thank you.
Thank you.
Thanks again to our panel and to Cheyanne for joining us.